Digital pathology has always been forward looking and saying in the future, this is how it's going to be, and this is how it's going to be in the future. And I think we had a little bit of a different approach at Indica in that it was always realizing, hey, there are customers that need our help right now, that need products right now, that need solutions right now, and building things for them and a little bit more of a pragmatic approach as opposed to that forward facing. That's where you're focused on those problems they have and you're kind of providing solutions for what they have in the here and now, as well as looking ahead, but not so much building things and telling them, hey, this is what you need. It's the opposite approach of customers telling us this is what we need, this is where the gap is, and then we fill that with solutions.
Welcome to the People of Pathology podcast. I'm Dennis Strank. On this podcast, we explore pathology one story at a time and connect with the people behind the diagnosis. We've seen many use cases for AI in pathology, but the real question is, how do you make AI available to everyone? Today, we're looking at the world of digital pathology and artificial intelligence with Adam Smith from Indica Labs. We'll talk about the evolution of Indica Labs from the early days of Halo to the integration of AI, and we'll get into what it really means to bring these innovations to the masses. All right, here's Adam Smith. So I'm going to start with you. This is kind of an interesting story because you started as a customer of Halo before joining Indica Labs. So, and you joined, I think, well, we'll get into this. You joined Indica in 2015.
Correct.
But can you start with being a customer? Like, what sort of capacity were you a customer? What were you doing at this time? And then I want to get into how that brought you to Indica Labs.
Sure, yeah. So at the time, I guess I first learned about Indica. I was working for Merck in their safety assessment pathology group. So I was doing everything from necropsies through the histology process, and then eventually got into digital pathology. And then I was working in the Aperio platform at the time. And so we've been around like 2013 or so, and started building plugins for the Aperio system. So the first thing I actually learned about Indica through Twitter, of all places, they built an eyedropper tool that was used for color selection as part of the color deconvolution process for image analysis. And it was just really cool plugin. It really simplified the whole process and it made my job much easier. And so that was first exposure to it, and then got to know the company a little bit better. Picked up on the cytonuclear tool, which is one of the algorithms that Indica built at the time. And again, it was pretty revolutionary for what was available at that point from Aperio. And again, just plugged into the system we had. So using that product, we had a study that was a pretty high profile one at the company at the time. And so it really simplified things, reduced the analysis time from 3 hours per slide down to 15 minutes per slide. So ultimately saved months of time, and it was really big advancement for us. And so kind of through working with the company that way, got to know Stephen Hashigan, our CEO. At that point, it was 2-3 people in the company. So I'm going directly to him for all my customer support. And he always just really had this really relaxed and helpful attitude about support. I remember specifically one time I was kind of beating my head against the desk trying to figure out this issue, and called him up. And he's like, why are you doing that? Just call me, right? And so that whole approach, literally having like CEO on speed dial, it was this really relaxed attitude and helpful attitude and just a practical attitude. So that then got me really interested after meeting a few of the team members at that point. Immediately, which is, man, this is a company I want to work for, and just aligned on a lot of different things and ideas and the way we worked. And then 10 years later, and we're still here. So great move. And, and we've since then, we've really recruited a lot of people from our applications team, from customers, and that connection there, I think, works really well. And having scientists working in our field team that are speaking the same language as our customers, are able to identify the problems they have, identify solutions to the problems in the lab, and put the right tools in their hands.
Okay, something you just said about speaking the same language as the customers. And I want to talk about this a little bit because that's really important. I've been in the pathology field for 22 years now, a little bit longer. And at the beginning, new technologies would come out and you could tell that they weren't really built by people who worked in the field, right? And they didn't really speak the same language. And I think now that's becoming more of a priority for a lot of companies, certainly digital pathology and software companies, right? Am I right about that? That's more of a priority?
Absolutely. I mean, it's kind of always been a priority for us. So I think digital pathology, one of the things, like, for better or for worse, digital pathology has always been forward looking and saying in the future, this is how it's going to be, and this is how it's going to be in the future. And I think we had a little bit of a different approach at Indica in that it was always realizing, hey, there are customers that need our help right now, that need products right now, that need solutions right now, and building things for them and a little bit more of a pragmatic approach as opposed to that forward facing. That's where you're focused on those problems they have and you're kind of providing solutions for what they have in the here and now, as well as looking ahead, but not so much building things and telling them, hey, this is what you need. It's the opposite approach of customers telling us this is what we need, this is where the gap is, and then we fill that with solutions. So it's a little bit of a combination of the two, right? I mean, you can't sit in the present in the past and grow, but I think that there's a lot of solutions in the present as well as looking forward.
Okay. I like that. I like that perspective. That's good. Now, like you said, you've been with the company Indica Labs for 10 years, and I'm sure you've seen the company grow in that time. There's probably been a lot of milestones, key events, things like that. Can you talk about some of those key events over the last decade?
Yeah, absolutely. There's four I think that really stick out in my mind as like inflection points for Indica. And so the first one is just a bit before I joined, but that was shifting from building modules for the Imperial platform to building our own image analysis platform in Halo. Right. So that then kind of put more of the control of the platform and allowed us to build more tools within it for the customers. And so that was a big jump off point there and really kind of a serious undertaking for the company at that point. Second would be building Halo Link, which is our life science image management system, right? And so prior to that, we were dependent on eSlide Manager, using that as a third-party integration for an image management system. And what we realized pretty quickly is that when you're relying on third-party integrations as a customer, you're relying on two companies to kind of work together in lockstep to keep those products integrated. And if one company's roadmap diverges, the customer's left sort of holding the bag and they're stuck waiting for a solution, right? And so we realized that if we then control that connection between your image management and your image analysis, everything that's being built for Halo is being built with Halo Link in mind and vice versa. And so you really have this seamless transition between image management and image analysis and can leverage those two tools right there. So that was a big one for us. Third would be Halo AI, jumping in the AI space. I think that's obviously a massive part of the field right now. We went into the Chameleon Challenge in 2017 and came out as a top commercial solution for that particular AI puzzle, so to speak. And then the final one is launching Halo AP. So that was our first step into the clinical market. Prior to that, we really focused on research, which again was a bit of a different approach than a lot of the digital pathology field. Focused on research, but in the meantime, really build a mountain of evidence that we were building quality products, we were building quality solutions for customers, and then kind of take that and apply it to the clinical space, which is interesting that I think it mirrors the drug development process pretty closely, right? You're building this mound of evidence in research and then transition that into the clinic. And we've kind of ended up taking that same approach there in that research to clinical movement. So those four right there, I think are kind of the big inflection points. They were diversification for the company as well that allowed us to have multiple streams of revenue coming in and serving different customer bases, all while growing organically as well.
Okay, that's interesting. I want to get back to some of the aspects of Halo AI in a bit, but first, a little bit more about you as far as like your role in Indica Labs. So you're the CCO, the Chief Commercial Officer, right?
Yep.
You can talk about first of all, what does that mean, and then what do you do in that role?
Yeah, so I've only recently taken that role on since January or so. So our CSO, Kate Lillard, or former CSO, Kate Lillard, stepped aside and I moved into assuming the commercial responsibilities that she had. And so really managing our clinical and life science commercial teams on that front. So we have input on product development as well. Our commercial teams cover support and sales as well. So it's a little bit of both there, kind of balancing those worlds. But yeah, just kind of making sure that everything keeps moving along on the commercial front is really what it's been so far, and keeping an eye on the future and trying to keep that continued growth for the company.
What was the adjustment like in you getting into this role, and was there a steep learning curve, or was it fairly easy for you? Can you talk about that?
Yeah, I mean, I'm still learning as we go, to be totally honest,
Okay.
and it's one of the things I love about the job, and it's something I've done, I think, since I came on board in 2015, right? I'm coming in as a scientist,
Yeah.
totally from a research background and jumping into a commercial role. So it's been a lot of learning on the job, keeps the job interesting, still learning as we go on some things here and there, but also have a decade worth of learning under Kate and Steven, working with them closely and their guidance. And so it's been a fun transition, taking on some new things, but at the same time, it's every day something new and learning something new.
Well, I mean, that's one of the great things about pathology and probably digital pathology specifically. There is always something new to learn, and especially now with the field advancing so quickly, right?
Absolutely. Absolutely.
So let's get back to the Halo AI. And I know you mentioned in other places the idea of bringing AI and deep learning and large language models to the masses. And I got to imagine Halo AI is part of that, right? So can we talk about this? What does this look like?
Sure. So I mean, the goal for us, whether it's Halo AI, really all of our products, is to take complex computer science, put it into a simple interface, and keep it in the hands of pathologists, histologists, the people who are really closest to the work. So you take something like an IHC assay that you're planning to run image analysis on downstream, right? And I think when you keep it in the hands of the person who's maybe developing that IHC assay, right, they're close enough to understand what's true signal, what's background staining, what are false positives. And so as you're developing that assay, you're closer to it, right? As compared to shipping it out to the computer lab, you lose a few degrees, you have a few degrees of separation there, and there's potential for data coming back that maybe doesn't totally make sense or is misleading because you're showing results that maybe biologically just don't exist. And so the goal for us has always been to kind of keep it as close to those experts and decision makers there as possible. So taking that complex computer science, putting it down in the simple interface and making sure that the tools that we add are bringing value to the product, are allowing advancements in it, but are also not then cluttering or confusing the interface that it becomes too complex. So just a constant balancing act of those two ideas.
Okay, I see. It sounds like you're creating these algorithms, these products, and letting the customers try them out, right? Like, how much back and forth is there in developing
Yeah,
something like that?
I mean, there's quite a bit. We do hands-on trials for just about every sale of the software that we have, right? We're pretty
Okay.
confident in our tools that we think that once you get your hands on them, once you're using them, you're going to want to continue to use them or you're going to see the value in them. And so, like, we're happy to kind of prove it with the customers and not just sell you on the idea that this is going to work, right? We want to get in your hands. And if it doesn't, we don't want to sell it to you or we need to go back and fix it and make sure it works for you as well as the other pieces. So it's a lot of back and forth there, a lot of support from our applications team in providing training for those trials, in providing support as they're working with an AI model. I think AI models, we don't claim that they work 100% right out of the box, right? The idea is that the customer is going to add additional training data to those models to make them fit their assays. And our pre-built models reduce the amount of training that's required for that dramatically. And so we support them in getting that new training data into the product, testing it, and again, making sure it's a good fit before they buy anything.
Does that new training data then kind of turn around and help you
No,
make the product better?
it doesn't. We don't take any of the training data. So that's one of those gray areas I think of AI that there's been some controversy over the years as far as like where's the data come from and then who owns the data.
Oh, okay.
Some of that's still problematic. And so we've always taken the approach that the customer kind of builds their own thing. Anything we do that is pre-built, it's either coming from public data sets or through collaborator agreements that we have set up with customers and collaborators that we purchase access to a data set or do an in-kind exchange for access to a data set, and we use that to build and then allow the customer to build from there. And so there's never cross-pollination between different customer sites or independent customer sites, right, that are building models. The training data that they put into a model stays with them. It doesn't then cross-pollinate into other customer sites.
Okay. Now, I imagine these people are customers already. They want to get into using AI and they're excited about using Halo. But, anytime you talk about AI, especially it seems in pathology, there's always this fear, right? It's going to replace us. It's going to change our jobs, things like that. Do you ever have to deal with things like that?
Yeah, I mean, it's changed over the years too, right? I think the first time that I saw a digital slide scanner all the pathologists in our group were like, "Oh, this is going to replace us." It's like, no, this is going to help you. This is a tool to
Right.
come along with the experts, right? It's just another tool to help you in your decision making, to provide backup on your decisions that are there. So the idea of replacement, I think, has never been there from my perspective. It's always just an additional tool, really, for a small population, right? Pathologists, the number of pathologists is growing much slower than the number of patients or the number of applications for digital pathology. And so, if anything,
Right.
it's allowing them to cover more with the fewer people that are coming into the field.
And that's one of the key aspects, I think. I mean, like you said, number of pathologists is growing, but slowly, and there certainly aren't enough pathologists around. But it seems like the number of cancer diagnoses worldwide is growing even faster, right?
Yep.
So the need for something like this to help pathologists and pathology in general more efficient is very needed right now.
Absolutely. Yeah, I think every time we get senior pathologists who are really champions of AI or digital pathology, it makes just such
Hmm.
a huge difference on adoption, either within a group or within a community. Yeah, again, when I was at Merck, Sam Mahaka was one of the senior veterinary pathologists and just incredibly well respected. And he was one of the guys that was behind digital pathology adoption at Merck. And I think because Sam was there and he was the one that was promoting it, everyone else in the group was encouraged that, but if Sam's behind this, like, we got to get behind it too. Like, he's experienced, he's an expert. And so anytime you have those champions, it's just incredibly valuable for the entire field that they're the ones influencing their peers.
When you're introducing Halo to a new facility, say, do you think it's vital to have that kind of champion there? Is that helpful?
I think so. I mean, it's always easier to drive adoption when you have, I say, people on the inside that are helping to promote it, as opposed to
Oh,
down,
yeah.
right? Like, you just have someone higher up coming in and saying, "You guys are going to do this," versus someone within the group saying, "Hey, I found this tool. This is going to help us immensely. Come try it
Mhm.
out." Right? Those are two very different methods of adoption, and one moves more smoothly than the other every time for us, and I think for the end users as well.
This is the People of Pathology podcast with our guest, Adam Smith from Indica Labs. We'll be right back. When it comes to cancer staging, one of the most important parts is finding all of the lymph nodes. I should know, it's what I do every day. Yet this process has remained the same for over 100 years, manual, tedious, and time consuming. That's a problem because every missed lymph node can mean inaccurate cancer staging. That's about to change. Enter InVision from Cision Vision, a first of its kind device that's redefining the standard of care. Traditionally, we identify lymph nodes by sight and feel alone. InVision changes that using shortwave infrared technology to make lymph nodes stand out clearly from surrounding fat and in real time. In its first 104 patient study published in the Journal of Clinical Pathology, InVision helped increase lymph node counts in 86% of cases and even upstaged 4% of patients from N0 to N1. I personally contributed to this study, and let me tell you, seeing the technology's impact firsthand was amazing. It's time to invest in grossing innovations that improve patient care. So, how is your lab approaching innovation in grossing? Book a demo at demo.cisionvision.com and start seeing lymph nodes like never before. Are you thinking about applying to a pathologist assistance program and feeling a little lost? That's why I created the Path to Path A, your PA school application blueprint. This is a step-by-step prep course that gives you everything you need for a strong application. From finding shadowing to writing a standout personal statement to prepping for interviews, this course was made to help you feel informed, confident, and ready. Visit www.thepathtopatha.com to join the mailing list. You'll be the first to hear when the course launches. Your path starts here. And now for the rest of my conversation with Adam Smith on the People of Pathology podcast. Are you able to talk about some of the specific AI tools that are available in Halo?
Yeah, yeah,
And what would like some of the most popular ones?
sure. So, I mean, when we started out and launched Halo AI, we had one available framework in there. It was the VGG network, which was well published, but at this point is pretty old. And since then, we've incorporated two other kind of open-ended networks that you can build from scratch: our MiniNet and our DenseNet. Those are set
Okay.
up to kind of, you come up with a blank slate essentially, and can add training data from images and start to build classifiers or segmentation networks. And then we have a few pre-built ones that we've added. So we've done nuclear segmentation for bright field and fluorescent images, membrane segmentation for bright field and fluorescent images. We've got a phenotyper, which kind of looks at the object in context and helps to classify those. And then also we have a pre-built slide QC network that goes in and identifies like folds, air bubbles, things like that. And then you can exclude them from analysis. They're not skewing your data. AI apps that are pre-built, so both for life science or for clinical applications. So several different cancer indications, so segmenting tumor and stroma, removing benign tissue, things like that, and then also some cell counting applications there as well. So pretty wide variety, pretty wide range of them. Like I said, the life science ones are all RUO, and then on the clinical side, going through and getting CE-IVD for our prostate algorithms, and we have a few other clearances in the works as well on that end. So yeah, quite a variety at this point for starting out as being kind of a blank slate approach to a pretty nice library of tools at this point of pre-built. But this pre-built solutions also, they require the input then from the customer to kind of finalize them and make them really generalizable to the customer's data set.
Okay. You mentioned starting out kind of a blank slate approach. I wonder, in the 10 years you've been with the company, has that approach changed? Is there like a philosophy behind it or something like that as far as developing new tools?
Yeah, it has changed a bit. I think a lot of that's been customer driven. For a long time, we would be at conferences and you'd have customers come up to the booth and they would say, "Hey, do you guys have AI?" And our response was like, "Well, sure. What do you want to do with it?" And Scott,
Uh-huh.
I don't know. I was just, their manager told them to come learn about AI at this conference. And so they didn't really have directive or specific applications that they wanted to work with. And then as the years progressed, now you see much more. Someone comes to the booth and says, "Hey, do you have an AI app for segmenting non-small cell lung cancer and identifying lymphocytes in the stromal compartment?" So like those just much more specific applications today than you had
Okay.
5 years ago. So we're seeing the customer requirements come in and be more specific, then that allows us to then build as well. If we find gaps in what we have and customers are coming to us requesting applications, then we're like, okay, yeah, we can build that and we can work with you and build it custom or build it as a commercial product. But having those much more specific requests, I think it's helped us to go from being an open-ended solution and sort of a blank slate to more specific researching and clinical questions.
Okay. I like that. I like that approach too. Something I wanted to ask you, because not every lab has got the infrastructure or the staff to implement AI.
Mhm.
And so I'm wondering, like, are there ways that to help smaller institutions kind of get over that hurdle, I guess? I mean, I know you mentioned the QA aspect, which I think would probably save a lot of time and potentially a couple staff positions. But can you talk about some of that?
Yeah, we started to hit a point. I would say it was really as AI started to get adopted where the hardware requirements changed a bit for implementing Halo and digital pathology in general, requiring GPUs. And we saw this big shift on the IT side. And what we did, we launched our cloud services team. So that was in, I think, 2023. And that group comes in and we'll run into sort of biotechs that are scaling up. They don't have a ton of IT support yet or IT infrastructure there, or even large pharma. We were kind of surprised the amount of large pharma that was interested as well in that they just don't have dedicated IT for these tasks, or the tasks that we're asking them to do in digital pathology are kind of outside of the scope of normal IT support within an institution, right? Moving these massive files and moving them quickly and moving them really
Yeah.
across the world, right? It's not something you're doing every day. And so the cloud services team can come in, they can help set up your AWS infrastructure, right? So now you're not buying all the hardware, you're able to go through AWS, and the cloud services team can either manage that for you in your environment, or they can provide tools to the IT team that you have that kind of help to optimize performance while minimizing your AWS bill. On top of that, so there's a few different iterations that they can have in there, but have a really wide range of customers who have been interested in that offering. It also
Mm.
simplifies the install and updates of the product as well. So we've got a couple use cases where, in a clinical setting, it goes from having a PO to a production environment in less than 30 days, which working on
Wow.
on-site, on-prem hardware is pretty unheard of. And so being able to simplify that and provide that direct support really simplifies the process. So Like I said, it's a wide range of offerings there, everything from a fully managed solution all the way through providing those tools to the customer's IT team to help them work through the demands of image analysis and digital pathology.
Okay. Yeah, from what I've heard, that kind of IT, I don't know, transition, I guess, or implementation aspect is one of the big hurdles also. So it's good to know that there are ways to mitigate that, right?
Yeah, absolutely.
Okay. I want to talk about partnerships because I know Indica Labs is partnering with some companies like Lunit, Visiopharm. And I've noticed that there's quite a few companies in digital pathology that are doing partnerships, collaborations like this. Why is that important to adoption of digital pathology and AI and advancing this field?
Yeah, I think the partnerships are pretty critical in that we do a lot of things. We have a pretty diverse offering, but we're also not so arrogant to think that we're the only ones or the only tools that the customer is going to use. And so we've always had this open pathology ethos. We're willing to work with partners, we're willing to work with competitors, and really partner up as needed so that the customer ultimately benefits from it. And so the partnerships with someone like Lunit, who's an AI vendor, we've worked with them to integrate some of their algorithms into our Halo AP, our clinical offering, and allow that third-party AI tools to be there. So partner with them. There's a few others that recently we've partnered with as well. Visiopharm is one that it's a direct image analysis competitor and probably our biggest competitor for a long time. We've partnered with them to be able to integrate their image analysis solution to our image management solution. So we have customers who use both Halo and Visiopharm, and we can enable that analysis on both of those, right? Again, we're not assuming that we're the only ones in the game. There's different tools, different applications. And so if a customer
Hmm.
to do it, we'll enable it. And so we think that open ethos really allows for the customer to ultimately benefit. And then a different type of partnership for us is our partnership with Leica Biosystems, which was announced, I think, January this year. And you mentioned a lot of these partnership announcements that come out in the space, but I think a lot of them at the end of the day don't have much teeth to them, to be totally honest. It's a press release, but at the end of the day, what it means is there's no exclusivity to it. There's no tight integration. It's just kind of, hey, we're going to put this press release out. And it doesn't really mean much to the field. So with Leica, it's a bit of a different story, right? They actually came in, they invested, did a minority investment in the company. They're now our exclusive reseller for our image management systems, so Halo Link and Halo AP. And really what that did for Leica and for us, right? You have a company like Leica who they're leaders in the field in their stainers, their bond stainers are everywhere. Their GT450 scanners are in just about every lab we go into worldwide. And so they really got the hardware side of things locked down. And I think they were looking for kind of the next generation image management for them, right? And they saw a solution in us in Halo Link, but also then in being able to provide AI solutions and image analysis solutions to the customers as well. And so now you really complete that workflow of doing everything from reagents through the hardware, through the images and the image analysis and the data on the back end. And so through that partnership, I think it really allows us to support the customer kind of the whole way through that pipeline. And then ultimately with the goal of developing companion diagnostics together and again, supporting those workflows with the customer. So yeah, some different flavors of partnerships there, but that I think that open pathology ethos for us is always going to be there. It's always been strong. And with that goal of at the end of the day, the customer is the one that benefits from those partnerships.
Right. That makes sense. And it accelerates development in the field, not only pathology, but you mentioned companion diagnostics, which is a good, I mean, that shows how all of this stuff eventually benefits patients, right?
Yep, exactly. Exactly.
So if we're looking ahead 5 to 10 years, say, with the advancements in digital pathology and AI, what do you think might be some opportunities for Indica Labs in those next 5 to 10 years?
Yes, I mean, I think the in the digital pathology space, right, the kind of carrot on the end of the stick has always been clinical acceptance and clinical usage of the products. I think that's where
Yeah.
a lot of companies have focused and tried to build. And so, but again, I think it's always been like in the future. But I think we're finally hitting that point with both AI tools providing more robust solutions with regulatory acceptance technologies that's starting to come through, and then also the hardware capabilities to support them. I think that reality is coming closer and closer. That in the next 5 to 10 years, we start to see more and more clinical applications. And again, that's our longer term goal was to be involved in companion diagnostics with customers, with Leica, supporting those. So I think where everything's moving, like I said, technology wise, regulatory wise, I think that has a chance to be a reality in the next 5 to 10 years.
Okay, that makes sense. Can we talk a little bit about companion diagnostics as far as how, I guess, how does how does Indica Labs contribute to development of those tests?
Yeah. As we've gone through and diversified that portfolio of offerings, right? We now have tools that can be used kind of in every step of the process, right? From assay development and discovery which biomarkers want to be the focus for a companion diagnostic, right? And then you're then leveraging that same tool then as you get into sort of different steps of the process. It allows for the exchange of those digital assays between groups within a company, and then allows for ultimately lockdown and transition into Halo AP, which is going to be that clinical image management, clinical trial management platform, and overall workflow management there as well. So kind of supporting every step of the way on that digital side of things, but also then again, when you're in partnership with someone like Leica that is then supporting on the reagent front, we're involved early in that assay development and making sure that we're building that assay with that ultimate end goal in mind of a digital companion diagnostic, right? And it's not something that's being shoehorned into that at the end of the process. It's the entire way through. The intent is to make that digital and to make that available through a platform like Halo AP.
Okay, got it. So, Adam, this has been a really interesting conversation. I appreciate learning more about you, learning more about Indica Labs and the Halo system. So, Adam Smith, thank you very much.
It's been a pleasure, Dennis. Thanks for that.
If you're looking for another episode of the People of Pathology podcast to check out after this one, here's a clip from my interview with Dr. Matt Cicchini as we talk about the use of agentic AI as a pathology tutor.
So imagine you start your residency and you have this agentic AI tutor and it knows where you are. It knows that you really don't have a background in histology. And then it's working with you as you're looking at slides. And so it's maybe it's running as you're looking at the digital pathology slides and you really have no idea what you're doing, how to approach this. And it's guiding you towards that and helping you make those insights. But then it grows with you as you develop, right? And so when you're in your final years of training, it's not just giving you all the answers, but it's pushing you to make some of those additional connections and concepts to really to refine your knowledge to get there as a pathologist. And so I think these tools can really, like this is just one example, but I think we can really start thinking about how we can have these agentic type tools really improving our efficiency in as pathologists and educators.
You can hear the rest of my conversation with Dr. Matt Cicchini in episode 193. All right, big thanks to Adam Smith. Here's a fun twist. After we recorded this interview, I actually got to meet Adam in person at the Pathology Visions meeting. That's a first for me, and it was great getting to chat with him in real life. From his early days as a customer of Halo to his leadership role today, Adam's story highlights how Indica Labs has always kept one principle at its core: helping pathologists and researchers do their work more efficiently and effectively. What began with the introduction of the Halo image analysis platform has evolved into a full system: Halo Link, Halo AI, and now Halo APDX, each designed to empower users with intelligent tools that integrate into their workflow. We also heard about Indica Labs' commitment to accessibility, ensuring that labs of all sizes, from major research centers to smaller institutions, can benefit from AI and digital pathology. Adam described how the company's partnerships with leaders like Leica Biosystems, Lunit, and Visiopharm are expanding the reach of these technologies, building bridges between software innovation, hardware, and clinical practice. He mentioned that these partnerships have actual real-world value, rather than just partnerships on paper that sound good in a press release. For Adam, AI isn't a replacement for pathologists, it's a way to augment their skills. This then frees them up from repetitive tasks and helps them to focus on what matters most, delivering insights that improve patient care. Looking to the future, Adam envisions a world where AI, deep learning, and even large language models are woven into daily diagnostic practice, tools that every pathologist can access, understand, and trust. It's a vision not just of technological progress, but of empowerment, bringing digital innovation to the people who need it the most. As always, I'll have links in the show notes to everything that we've talked about today. Don't forget you can follow the show at People of Path on both Instagram and Twitter, or just connect with me on LinkedIn. Thanks for continuing to share the show with others. Together, let's inspire the next generation of pathologists and laboratory professionals. This show is a member of Health Podcast Network. Thanks for listening. I'm Dennis Strank, and I'll talk to you next time on the People of Pathology podcast.